Hey guys,
Hey guys.
how are you? Welcome in to the 3-day EKG challenge. We are now on night 3 and we have a special treat for you in that Coach Michelle is here and she's going to do a game to cement some of the things we've learned. So I'm going to go ahead and hit record and I'm going to turn the floor over to Michelle. And once we're done with Michelle's game, which you're going to love, we're going to do the basic 12 lead section. So Michelle, take it away.
Okay, all right. We're going to get started right away and do our little game. So this was a new one that I've only done one other time before. So we're going to see how y'all like it. Um, and since I haven't done it a lot, sometimes the logistics of getting the numbers are my fingers. So what we're going to do is help me watch in Facebook and Zoom. Let me get the chat up before I start it so I can see the answers. Hey, so Carrie's on, KJ's on, Silas is on. Trying to see who's in the Facebook, and Ruben's putting us on. Callie's on. Yes. All right. So what this is, I don't know if anybody's played the connection game that everybody's talking about lately. So you're finding connections on words. So I'm going to put some words up there or some strips or some different things, and you're going to tell me what the connection is. To make it fair, because I've done this before and sometimes it's a little hard to know, is Facebook winning over Zoom? In fact, I need to get my pen out so I can try to like catch on who is winning. So I'm going to get my little piece of paper here, my little cheat sheet. Zoom rules. Yes, Silas says Zoom rules. And I don't know if there's a lot of people on Facebook yet, but I'm going to try to see if people answer, because it does take another couple, like 2 or 3 seconds for Facebook to answer the question. So I want to make it fair. So what we're going to do is we're going to let, if anybody's on Facebook, I'm going to say, okay, Facebook is going to answer the questions first for the first question, and then Zoom is going to answer if Facebook doesn't answer it, and then we'll swap on the next question. So let me see if that works. And whoever gets the most points, I'm going to try to keep track of the points. And I have some lovely little mug rugs. I think I've got like 4 or 5 mug rugs up here that we can give away. I think I've got a little bit more of that. So we're going to see how this works. All right. So the way this works is this is the example. This is the example. You don't have to make any question, or you don't have to type in on this one. So this would be how the game works. Here's the first question. Here's the first thing that we're thinking about. And the question is, if you got these right, red. If nobody answers, I'm going to count to like 1, 2, 3, and then I would give the next clue. The next clue is blue. If somebody said, so what does red and blue have to do with each other? Oh, Silas says American flag. Good choice. That's actually a really good choice. But the next question is brown. So if nobody got it, I would give away the last one for 1 point. And the last one is, oh, my chat's in the way, I can't see it. The last one is pink. And the answer to that would be just colors. Let's see if the colors coming up. Are you coming up, colors? Come on, answer. There he goes, all colors. So it's on that particular one, the answer would be colors. Now, I make the next questions up, so you have to like kind of think what I'm thinking too. So if anybody can think like me, KJ, you're pretty good at thinking like me. I was thinking EKG. I know this was just my example. This was the example that went along with the game. And again, at the very end, just so that we're always giving credit to things, this game is a game I found on PowerPoint, or I found on the internet. This place makes games for different educational purposes, and I always give credit at the end to where these games come from because I want to make sure I do that. Okay, so that's at the very end. All right, so here we go. Now these are for the EKG questions. Okay, so if anybody's on Facebook, we're going to let Facebook go first with the first one. So let me give the very first, number 5. Okay, so get ready. And again, I'm just trying these out. Okay, so here's the first clue. The first clue is the letter P for 5 points. I'm going to give it a couple seconds. If anybody in Facebook wants to give an example or give a thought. Okay, now I'm going to go to the next question, or turn it. Sorry, I'm trying to get my thing on here. So the next one is QRS. Okay, so now Facebook or Zoom could answer What do you think this is? Oh, and somebody's already answering. Somebody is answering and they've already said waves of the EKG. So I think they did that at the second one. And the second one was EKG waveform. So hold on a second. All my stuff is in the way here on the screen. Okay. So I saw Carrie answer that first. Oh, and Matt's on and Michelle. Yes. Okay. So the first one to answer on those was Carrie in Zoom. Okay. So I'm going to give Zoom 3 points. I'm getting my questions here, getting my paper. I'm just cheat sheeting it, writing on my little paper. So right now, Zoom has 3 points. Okay. Okay. We're going to let Facebook get one question. Give it a couple seconds to make sure that Facebook's up on us. Okay, here's question number 2, and it is sinus node. Okay, so let's see how we go. Okay, AV node. I know this is a different game. So sinus node and AV node. Oh, we've got some people that say, Matt says pacemaker spikes. He was the first one on Facebook to say that. And then I've got electrical pathway on Zoom. And the last one was the right and left bundles. So yes, the electrical system, I'm going to give that to Matt because he said pacemaker sites. So he did actually type that in pretty fast. So he got that at 3 points. Okay. All right. So we're kind of seeing how this works. All right. I don't have a lot of questions, so it won't be too terribly long here. Okay. So you ready? Here's the third question. Okay, give Facebook just a half a second to catch up with us. And okay, we've got PR. We've got some already answers here. We've got intervals on the number 5 for 5 points. We already have intervals. QTC, I'm watching Facebook and I'm watching Zoom. I've got ST. Matt says intervals. Michelle says intervals. And we've got RVR. And the answer is intervals. So I'm actually going to give that to both of y'all. I'm going to give you both 5 points on that because there was about the same time. I'm watching both of the answers here. So both of y'all basically got that typed in at about the same time. All right, here we go. Here we go. Another one. All right, here we go for 5 points. Reciprocal. Give Facebook just a couple seconds to catch up. 1, 2, 3, so that they can see it. The first thing is reciprocal. Sorry. The next one is contiguous. We've got contiguous is our next word for 3 points. And I've got leads. People are typing in leads on Zoom. Michelle says rhythms on Facebook. Lateral and inferior. Matt says 12 leads, but I had leads first on Zoom. So Zoom got it at 3 points. Carrie and Petra, and KJ all said leads on, they were fast typers. Okay, so Zoom got 3 points. Okay, guys, Zoom is 3 points ahead. So let's go. All right, here we go. Next question. Absolute. Jennifer talked about this yesterday. Absolute. She talked about absolute for 5 points. I'm going to give the next one for 3 points. Relative. Cheryl says refractory. I've got refractory in Zoom on 3 points. Matt says refractory. Oh, but refractory is one of the answers. Oh no, it's something else. Keep going. You got to think like me. Refractory. The last one is refractory period. Rates. This was parts of the T wave. I tricked you. Jennifer actually talked about the absolute refractory period and relative refractory period yesterday. I got you on that one. I didn't even think I could get anybody on that one. But she wanted to make sure you looked at those T waves because stuff can happen in the T wave. So nobody got it on that one. Okay, here we go. 1/3. Okay, this one shouldn't be too terribly hard. I know, sneaky, right? Silas, sneaky. Refractory periods, Matt. Okay, 1/3 the size. 30 milliseconds wide. Oh, KJ's already typed in Q waves in a pattern. Matt's typed in Q waves at 2 points, and KJ got it at 3 points. Stabbies is my favorite word, stabbies. And this one was pathological Q waves. Be careful. So actually, KJ got it first, and Matt got it right after. KJ actually got it at 1/3 the size. So I'm going to get Zoom gets 5 and Facebook gets 3. Matt and somebody else, Michelle, T-Waves. So everybody was typing in pretty quick on that one. Okay, I think I'm almost to the end. Let's do just a couple of these and on this next little section, and then we'll round it off to Jennifer. Okay, so on this one, you're going to see 3 clues. You have to tell me what the 4th clue would be in the sequence. All right, so let's see how this one works. So it's a little bit different. You're going to find the actual 4th clue in this one. So example, here's the same example. If I was to give you red, don't answer these. If I was to give you red, orange, yellow, what would be the next color in that sequence? And the next color would be green, which would be colors of the rainbow. This was just the example. This was just the example. So you give me the 4th choice in this. Okay, I'm making you work hard a little bit for this one. Okay, so the last one. Here we go. Ready, set, go. All right, so the first question for 5 points is inverted. Sorry, my words wouldn't work. The next one is tall and peaked. Tall and peaked. Carrie's got T-waves as the answer. Symmetric. Silas typed in T-waves, and so did Julie and Matt. Okay, everybody got it. That was like pretty quick. T-waves is correct and reverse check mark. So it all has to do with those T-wave abnormalities. So y'all actually got it. I think KJ got it at 2 points and Matt right about the same time. I'm trying to watch my times here. Okay, so I'm going to give y'all both 2 points on that because it's those T-wave abnormalities. All right. All right, so here we go again. R to R interval. R to R interval. Okay, yeah, you're right, KJ. It could be either one. That could have been my hint on that one. That was a little bit harder. R to R interval, regular. You can do either one. Regular. My last answer is rate. R to R interval, regular, and rate. R to R interval, regular, and rate. Any ideas on that? Method of reading. Okay, types of rhythm. This was actually normal sinus pointer. So the intervals are normal. Let's see. Did we get that? I don't know. Maybe these are a little bit harder. Might have to make these a little bit easier. P waves. I think it was actually normal sinus rhythm, what you would look for on normal sinus rhythm. The R to R interval, you want it to be regular. You want it to be the rate to be normal and your intervals normal. It's like what you would see with normal sinus rhythm. Okay. Okay, here we go. Okay, this one may be a little bit easier. The PR interval is 120 to 200. The QRS is under 120. The QTC is under 460. Rules of the EKG. What do you think? Rules of the EKG. Do we have it? Do we have it? Normal EKG. KJ got it at normal EKG. Matt, you typed it in at the exact same time. So the axis is 90. These are normal EKG rhythms. Okay. So I'm going to give that at 2 points for both. We're both running right about the same. Zoom has us about 5 points extra. I think we just have one more, Jen. All right, let's see. All right, narrow and wide. No, this one's a little bit harder, KJ. You're doing it. KJ has faster internet. That's funny. Narrow to wide, fast and slow. This is something Jennifer talks about all the time, and regular. Narrow and wide, fast and slow, regular. What would be the next one? QRS complex. Oops, come on, click over. These are rhythm answers to answer yourself. You could have either gotten irregular. Oh, Cheryl typed it in irregular. Yes, Cheryl got it. Matt typed it in irregular also. I think y'all got it both at one point. Rhythm questions to ask yourself. So these are the things that Jennifer says. I'm looking at the rhythm. What is one of the first things I want to see? Narrow, wide, fast, slow, regular, irregular. So those are the things you'd want to see. Okay. All right. So I'm going to give 1 point to each one of those. So I'm trying to write down the points at the same time. I think, that was the last one? Maybe this was the last one. Okay. AFib. Jennifer, one more question here. A flutter, SVT. Oh, Julie, atrial rhythms. Atrial rhythms. Yes, atrial rhythms, WPW, abnormal rhythms from the atrium. Matt got it too, atrial rhythm. Julie got it the very first. She typed it in the very first at 2 points. Matt got it at the end. Okay. I think that's, did I have one more question? Oh, I did. I don't even know how many I put on here, Jennifer. Sorry about that. Oh, this is the last one. Okay. Normal sinus, sinus bradycardia, sinus tachycardia, sinus rhythms. Cheryl's got it at sinus rhythms. Yes, these are sinus rhythms, things that happen in the sinus. Harry got it, and sinus rhythms. Okay, so 2 points, sinus rhythms. All right. All right. Jennifer, did you want me to show them this clock? This is the last thing I was, okay. So Jennifer had mentioned last night that I have like just a little picture. I'm very, very visual. I have to have everything in picture form to make sense in my head. So she uses a 10-step system. I made it into a physical clock, and I made the clock 2 different directions. And you can take a snapshot of this if you want on your phone, or you can take a screenshot if you want. So I have taken the clock and made each one of the numbers things to look at on your 12 leads. So first of all, is this patient big, sick, little sick? How fast are they going? How regular is the heart rate? What are the normal intervals? Is your axis normal? Is there any ST elevation? What's going on with those leads? If I see ST elevation and things are going up, and Jennifer's going to go over this tonight, do I see things going down? So I have things up and things down. So 2 leads up and 2 leads down. Is there any hypertrophy? So we're getting a little bit more. Is there anything else going on with these patients? And when you're going across that EKG, you always want to see, where are the T waves? They should all be up. All the T waves should be up. All the T waves should be up. And only 2 leads are they supposed to be down or inverted, AVR and V1. So you want to look at AVR and V1 and say, are they inverted? And they should be. When I'm going across the EKG, I look and see if there's any Q waves, because Q waves are bad. Q waves are bad if they're big and wide. If they're wide and tall, okay, or deep, sorry. Then I put it all together. So let me give you, when we get a little bit more advanced, we start talking about Brugada's and Wellings, indeed Winters. So I'm going to give you half a second if you want to take a snapshot of that picture, if you want to take a screenshot. This is not copyrighted or anything, and I freely give this away, so you can take a quick little snapshot of that. I'm going to give you 1, 2, 3, take a snapshot, and then, okay. So to make this even a little bit easier, hold on a second. Hold on. Give this 1 second. Okay. I made it in one more picture. There. Okay. You can take another snapshot of this. This is one other way to look at it if you want a little bit less busy on the screen. If you want to take one more snapshot, it's the exact same thing. Is it big, sick, little sick, rate, rhythm, intervals, axis, ST, hypertrophy, T wave, and Q waves, and then bring it all together. So I'll give you a couple seconds and you can take a snapshot of that. That's just another way to look at it if it's a little bit easier for you to look at, either way. Okay, and I think that's it. There's our little zebra running across there, Jennifer.
I love it. Michelle, that was so fun. I just don't even know how you continue to keep it so interesting and fresh for us, but thank you for that. So guys, did you enjoy? Did you enjoy this session with Michelle the game? Because let us know. We do base our next challenge or anything we do based on your answers. So we really want to know how you feel about it. But you guys did great. So thank you for participating, and thank you, Michelle. And we are going to jump right into now the lesson part, now that you guys did so great.
And I've got 4 of them, Jennifer, if you want to, at the end, have a way to answer questions. Zoom did win by 7 points. So however you want to answer, however you want to give them away, I have 4 of them.
Okay, what we'll do is you can put in the chat, #Michelle, if you want to be considered for a mug rug. And then once you we'll pull 4 names and then we'll announce them. Michelle can post tonight the winners and then she'll mail them out to you. So you could put in Facebook or Zoom. Looks like Carrie Foster is already putting in. She wants to win a mug rug. Okay, cool. KJ says she has 3 already. So Matt's demanding a recount. I love it. This is so much fun. You guys are hysterical. So let's jump into the lesson portion now. I want to make sure to wind up by 6 o'clock to get you on your way. So we have a lot to cover. But basically, in a nutshell, let's talk about some basic 12 leads. So we did have a winner of, as you remember last night, this arrhythmia giveaway. I don't think I've seen her on. So when I see her on, we'll basically congratulate her. I'll talk about this later because I haven't seen her in the chat yet. But we're going to talk about who's going to win the scholarship, and I want to announce that early on so that we don't hold the suspense, okay? Because as we've been talking about, we've been watching to see who's the most supportive, who's the most nurturing, and we're giving away a scholarship to our 30-day EKG challenge, which is like this, but we hang out with you for 30 days. And we do lots of teaching and kind of expand on what we've built here. It's in honor of my dad, who's pictured here, who's now passed, who would give anybody the shirt off his back. And so we were looking for somebody who was embodying that. And that turned out to be Carrie Ann on Facebook, who is also, I believe, Carrie Foster, if I'm not mistaken. So you are our scholarship winner, Carrie. We want to say thank you. You've showed up every night. You have welcomed people into the group that you didn't know. You have been cheering other people on and encouraging other folks as well to be active in the group. And so we want to celebrate you. We want to invite you into our family. You're going to love it. You're going to get 30 days access in our group to go through all the trainings, and I'll kind of show you more about that at the end. And for anybody who didn't win the scholarship, but I do want to also mention that I did see a lot of you other folks in there really supporting and nurturing as well. And so we are just so thrilled that you all are just being such good humans to each other. We love it. So thank you. So let's jump into the training. And Carrie just messaged me again, just touch base with me and I'll get you all the info. But here's why we do this training, because the software is not accurate. In fact, it's not accurate 6 to 42% of the time. So if we just use that as our litmus for what to do with the EKG, and I know I did that when I first started, it can get you in trouble anywhere from 6 to 42% of the time. It doesn't pick up STEMIs sometimes. It falsely calls STEMIs other times. There's other things that are really significant that are missed as well in the non-specific ST2 wave range. So it turns out that you just can't use this. And one of our lead coaches, David White, he says you can trust the software as much as you can trust gas station sushi. So we always have to represent him, our amazing Mandalorian, with our sushi reference here. But this is Remy coming back just to show us that in order to have a normal EKG, we have to have some things in place. So we have to have, going back, the T waves. They all have to be upright, except for AVR and V1. If any other T wave is inverted, there's a problem. We also have to have normal intervals. We'll talk about that on the next slide. And then, of course, normal voltage. So not too tall and not too small. We also need to make sure that our family is holding hands. Basically, the P and the QRS, mom and dad, and then T wave baby, they're all going across the EKG together. And then remembering that a normal EKG, right? We'll talk about that the next slide. But remembering we also need to understand what we're looking at, the anatomy, basically. Yeah, Remy, I know. And yes, congratulations, everybody. You are going to love it, Carrie. Seriously, you're going to absolutely love it. So let's talk about what is happening here. And so in case you're like very, very new, this here is the rhythm strip. Okay, this is we call it the long lead. This is what we're using to make a rhythm determination. You can see that there is a P wave here. We talked about rhythms yesterday. By the way, if anybody needs to catch up, there is a replay link in the group that I've posted. If you can't find it, let me know and I'll get it for you. But yeah, there's a P for every QRS. The rate is, however, there's something wrong with the rate, okay? So what is wrong with the rate? Type in the chat for me if you see anything wrong with the rate. Yes, exactly. Okay. They're Brady. And so the next thing I would ask you is what would you want to ask your patient, considering they are pretty Brady? What would you want to ask your patient? And this is just, of course, putting it all together right now, right? Heart rate of 42. We're going to ask them how they feel. Good. Are they fatigued? Yes. Are they an athlete? These are all perfect because if they're an athlete, this may be their baseline normal, right? So it turns out none of these are the case. They're not, they do have a little bit of dizziness. Is this normal for you? That's also good. Jay Nice is on here as well. Tanya's here. What's up? And making a good point, Tanya, about the beta blockers. So this patient was on beta blockers. And so what we did was we backed off on the beta blocker. We rechecked in a couple of days to see where the heart rate was because they were only mildly symptomatic. Now, the next part of this is understanding that, the waves, right? The P, the QRS complex, the T wave. And looking at this, you also need to know where the isoelectric line is. You're going to see KJ always saying that whenever we're in class, if you're in our 30-day. And here's where you line up, basically. This here is your isoelectric line. It's the area between the end of the T and the beginning of the P, and you always use that to line up. Okay. And that's really critical to understand. And then also knowing that we don't have a lot of artifact is critical. And then these numbers up here are also important to understand. And so we'll talk about that in the next slide a little bit deeper, but I wanted to connect the dots here for you on something that you may not have understood before. And I'm hoping this sets off a little bit of a fire in your belly to learn more about this, so to speak. So this here is the sinus node. And what's happening when that discharges is you get the P wave. Sending on down to the AV node, that is the PR interval, okay? And then when the impulse goes down, the left bundle and the right bundle goes down together, you have the QRS. And then when this repolarizes, you have the T. And so that's kind of an important concept as well to understand. So looking at this EKG, you can see that we had a couple little additions to add, and that's understanding that, again, AVR and V1 are inverted, and every other T should be upright. And I also drew a line across here so you could see what it looks like when it's drawn thin to go and really fine tune, look for any ST elevation or depression, because even a little bit can be significant, as much as 1 millimeter, which is one small box if you have elevation or depression, okay? So we don't in this case, but if we didn't draw our line, we wouldn't know. Now, a lot of people say to me, Jen, okay, literally, do you draw a line on every single part of the EKG every single time? And I actually have a tool, which is a badge, right? I use that. But otherwise, if I don't have that for whatever reason, I can use a paper and pen, right? Or the edge of a notepad. But you always want to make sure you do this so you don't miss very, very specific or very subtle elevation or depression. So in addition to the other thing I wanted to mention is the intervals here. So the intervals that are right here, basically what you're looking for, this is the heart rate. That should be between 60 and 100. The PR should be between 120 and 200. And the QRS should be skinny under 120, and it is. You can see the QRS is super skinny, which we like. The QTC here, that's quite critical, and that corresponds to this number here. And that is basically below 460, which is normal. And then this number here is axis. Now, this is going through this pretty fast. We obviously deep dive on all of this in our 30-day EKG challenge, including when you should really care about axis and when you don't even need to care about axis. And the answer is good news for you, by the way. So this is what a normal ECG looks like. But I'm going to tell you that even if you have your software saying normal ECG, it's not always, okay? There have been really subtle things that are present, so it's not always true, okay? So this is an EKG that I wanted to share with you just to give you some practice on looking at a 12 lead, okay? This is one I haven't given you any predisposing thoughts on. Okay. So this patient comes in and they have been having near syncope. Okay. So just to orient you to what you're looking at, because that's always important, you've got your rhythm strip here. Okay. And then, you've got your 12 lead here, all 12 leads here. And then you've got those, I love these delicious intervals. And so first of all, you know that something is wrong. And you can see right away that this here is too slow. That falls below 60. So maybe that's why they're having near syncope or syncopal, because they're going lower, right? It's quite possible. Now, my question for you is, if you know that the PR interval right here should be 120 to 200, and this is 338, what's going on there? Yeah, super Brady, Silas, exactly. Yeah, it's quite prolonged, right? It's quite prolonged. And anytime you have that much prolongation, you always want to think about, do they potentially have an underlying heart block? Now, we're not covering heart blocks tonight. Sean covers them in our 30-day EKG challenge if you're going to be in that. But basically what you want to do is really map out your Ps to make sure you don't have a heart block. Okay, always make sure. But this patient is super Brady, and at this point it looks consistent, the consistent PR interval, right? You don't see any hidden P's anywhere. So you would first think about heart block, because this is or a higher degree heart block. This is a very long one. This is one of the longest I've seen. And then looking for any prolonged QT that there's not, it's 463. And the QRS is 93, so it's still skinny enough, under 120. And then, of course, we're looking for, as KJ would tell us, looking for our NEST segment elevation as well. So we go across the whole EKG, and what you'll find is there isn't any. So this is a bradycardic patient and somebody who potentially, like Silas said, could have electrolyte issues. Specifically, hyperkalemia could cause this amount of bradycardia. So looking at the med list, right, looking at the whole EKG together, looking at the size of the T waves, Silas, good eye, because at the end of the day, there could be some hyperkalemia. However, there's just a couple T waves are big, not all of them, although it is still possible you'd want to get a potassium on this patient for sure. But this is just how you would troubleshoot looking at the 12 lead. And you can use Michelle's clock system, which I absolutely adore. And I highly recommend that you take that and that you start practicing her system, because her system is the best. And you practice looking big sick, little sick. I would say leaning towards big sick on this one, especially if they're symptomatic. Although this patient was only minimally symptomatic, right? Treat the patient, not the monitor, is the saying I will never forget from paramedic school a long time ago. So that's how you break it down. You're looking at all the things and making sure, for specifically, honestly, also for syncope, there's a couple other things you'd want to add on, right? You want to make sure there's no Brugada and that there's no hypertrophic obstructive cardiomyopathy. Because if there is, those are two things that are life-threatening that if you miss, the patient goes and could potentially die on your watch because you didn't pick it up. And here's the real shocking, sad, scary thing, is that the machine won't print that out for you. It will not say Brugada, and it will not say hokum. Okay, so Anthony says, ride the wave. So then another concept that is important to understand with the 12 lead is understanding the STEMI definition. Now, we talked about in night one terminology, where we talked about contiguous leads and reciprocal changes. And essentially what that means is that a contiguous lead is leads that are fed by the same artery. So for example, 2, 3, and AVF are all fed by the RCA, the inferior leads. And if you have elevation there, you need to go look for reciprocal changes. So you need to go look for depression. And if you don't have 2 up and 2 down, then you probably don't have a STEMI. Now, there are some exceptions. There are some definite more to the story on this for sure. But this is a chart for you to look and see what are contiguous and what are reciprocal changes. I'm going to tell you that if you're a visual learner, this is not going to work for you. All right. Like, this is a list. And for years, literally years, I was like, oh my, I was intimidated by this. And I was like, how am I ever going to remember that? So it came down to one day that I found a color coding system and I drew it out. And then I started to understand it. So I didn't just memorize. That's the trick. Okay. There's two tricks. Just memorizing this EKG stuff doesn't get you through. You'll lose it and it won't help you understand. But if you figure out a way to apply it so that you can understand it, then you don't forget it. And if you keep practicing, that's really the key. Okay. And yes, as KJ said, we do continue to explain. And Michelle even has a heart model that she brings out and she shows you everything, all the camera leads. And so you really understand it on a more visual level. But if you just want this info, this shows you the reciprocal. But let's do a little practice just to see if we can put it into effect. So no real patient's face here, but this gentleman had chest pain. He lifted a heavy box. So it's technically exertional. And he says, I feel like it's my last MI. That is very, very bad to me when I hear that, right? And it goes to his jaw, back, left arm, so it's pretty classic. Okay. And I know Anthony, yes, you're spot on that one. Um, and so the pain is 7 on a 10. He said that it's worse this morning. It's been going on for 3 days. So he's got history of stents previously. He may or may not be on his anticoagulant or his antiplatelet anymore. So who knows how far out that was, but here's his EKG. And Anthony, you'll like this one. This is right up your alley. So you can see that this is giving us a STEMI accusation. So, what do you do with this? Well, first of all, you go, okay, I have an acute STEMI. It says consider inferior injury. Well, we know that the inferior leads are at the bottom here, and we're making our lines, as KJ will always tell us to do. And when we do that, we start to see that there is more than 1 millimeter of ST elevation in two contiguous leads. So then that would be, there's actually three, right? Because 2, 3, and F are all contiguous. But also reciprocal changes over here in 1 and AVL using that chart. You could reference that, right? There's also a little bit in V2. So this is by default, yes, a true STEMI. This patient does need to go to the cath lab. And if you were over here also noticing when you were drawing your lines that there was some elevation in V5 and V6, yes, there was. It could be multi-vessel, but really at the end of the day, you only care if it's going away from you, right? If you're on the ambulance, you're alerting the cath team. If you're in the ER, you're alerting the cath team. If you're in primary care, you're calling 911, get them to where they need to go. And you could obviously be worried about the right ventricular wall being involved as well, because there's more ST elevation in lead 3 than lead 2. I think that's what Anthony was kind of mentioning. So just knowing how to troubleshoot working through this is key. And then here's another guy, no patient's face, of course, but this gentleman comes into the ED and he says he feels weak. I got to tell you, weak is one of my least favorite complaints, because at the end of the day, it can be a lot of things, right? It can be a urinary tract infection. He could be anemic. He could be hypotensive. He could be over medicated. But of course, we're going to get an EKG as part of our first line treatment and workup. And you can see here that this is actually telling us that there is ST abnormality. I'm going to tell you something, you guys. This right here, this ST abnormality is all that it's telling you, but this patient needs to go to the cath lab right now. Okay. Right now, because this is actually a posterior STEMI. And so you have, by making your lines, you bring out that there's some depression in V2 and V3. But understanding the heart, you would know, if you understand it, not just memorize, you would know that this is a reciprocal change to what's happening on the back. So if I have depression here, I have elevation back here on my posterior wall. So this patient is obviously going to go to the cath lab right now. You could do a posterior EKG using V7, V8, and V9, but you don't have to. This patient went straight to the cath lab and got stented. So really, there's a lot of landmines in this EKG reading stuff that the machine, again, is really not helpful. So you have to have a systematic approach. You have to be able to identify STEMI. And of course, there's some new guidelines that came out in November 2022 that showed there are new STEMI equivalents. And the new STEMI equivalents, there's 5 of them. This is one of them. And it was an article that came out. It was the consensus decision pathway guideline on how to treat chest pain in the emergency room. And it talked about new findings. Hyperacute T waves are one of them. D Winters T waves are one of them. Welland's warning are one of them. And so if those are things that you don't know, those are terms that are foreign to you, it's unfortunate because we don't get taught that in school. I had to learn that all on my own, and that was frustrating to me that we spent time on deep diving on depression therapies when there's all this high risk stuff. It was like, why didn't we learn this? So it ends up we have to do some extent of self-teaching or find someone to teach it to us. But just because we don't know it doesn't mean it isn't going to hurt us. And that's the scary thing. So anyway, let's go into our workbook. Yes, Anthony, it is super interesting, right? You should look at that article. I think you'd find some I can post a link to it at the end of this call, but it is packed with good stuff in it. If you are joining us in our 30-day EKG challenge, I do go over it in our workshop extensively, so you'll be more than well versed, and you'll have instant access to it when you join if you want to deep dive on it as soon as you join. But anyway, let's talk about our workbook. Let's pull out the last pages. Let's finish strong on this 3-day EKG challenge that you guys have been gutting it out every night, bringing the right answers, bringing the fire. So as we just said, contiguous leads, they are fed by let's fill that in, contiguous leads. They are fed by the same. Good job, Silas. Yes. And the next one down, this is easy, right? ST segment, you need in 2 leads, you need to have 2 up and 2 down, right? 2 up and 2 down. Okay, that's easy. This is one that I put in for you if you also wanted to practice drawing your lines. I didn't give you the answer to this one, but you could practice drawing your lines so I don't give it away. It's super fun, and there is 2 up and 2 down here, which I don't want to give away. So let's continue filling this in. This is easy, right? We're just going to fill in the inferior leads, fill in the anterior leads, and fill in the laterals, okay? So the inferior leads are easy, right? It's 2, 3, AVF. So we're going to type those in. The anterior leads are easy, V1 through V4. And those are basically the ones I think that Michelle refers to in her basic class as the sister leads. So the inferior leads are fed by the RCA, right coronary artery. The anterior leads are fed by the LAD. And the lateral leads are fed by the circ, which is one of the other arteries in the heart. And the leads that we'll need to write in there are 1 AVL, V5, and V6. So KJ is typing faster than I am. So I put this in the chat because sometimes my writing isn't as neat as we learned on our little homework that I posted. So here it is posted for you. But my writing isn't as neat and nice as the typing. So that's there for your reference. It's also in the group if you want to reference it for later. And this was put in as a blank piece for you so that you could basically go back in and practice your 10 step. You could write in the clock method if you wanted to. Basically, it's just a blank like memory jogging sheet for you if you wanted to use that. Okay, so that's there in your work book as well. So my system is really very similar to Michelle's, but I actually like hers better visually, but this is in your workbook if you want to fill it out. And then one thing I didn't talk about is that what were the lateral leads? Rachel, yes, the lateral leads were 1 AVL, V5, and V6. Good question. Thank you for asking. And then the chief complaint-based approach, which is your last part of your reviewing the 12 lead, is looking at them for, if they have chest pain. You need to look for ACS, of course, but also PE, also pericarditis. If they have shortness of breath, as KJ is saying, figure out your why. If they have shortness of breath, you're looking for PE. You're definitely looking at their legs. You're looking for, big voltage, maybe they have some CHF. You're looking for small voltage, maybe they have some COPD. So the chief complaint they have guides you, and there's certain things that you need to document per complaint, per the EKG, to keep yourself safe. For example, syncope, right? You need to make sure they don't have HOCM, hokum, or Brugada for sure. But you also need to look at their QT. Is it too long? Are they potentially going into torsade? So there's all sorts of like layers to this when you start peeling it away. on how to keep yourself safe and be a good, strong, bulletproof provider, because that's what we want for all of you guys, is for you to be bulletproof. But you need the tools. So actually in our 30-day, we actually give you dot phrases for Epic if you're a provider, so that you can just put them in on what you differentials considered. So like we give you the list for chest pain, we give you the list for dyspnea, and then you can actually be refreshed. Like it's a memory aid as well. So it's really cool. And then lastly, if you wanted to practice, you could kind of come over here and you could draw in the SA, right? The AV, and then down the bundles. And this is an EKG you could practice on if you wanted to. And I'm just going to tell you that that's not normal. It says it is, but there's two things that are not normal. And if anybody wants to tell me what those are, either now or in the group later, just tell me after you go through your homework, because I don't want to spoil the surprise. But basically, there is two things, and one of them has to do with a T wave and one of them has to do with the intervals. So yes, Silas, oh my gosh. Okay, let's go through big sick, little sick. So I'm so glad you asked, because literally I love this topic so much. So when I was a baby paramedic, they taught us, and this is a paramedic thing, I think. I didn't learn it anywhere else, but they said, hey, if you walk in the door, the patient's pale, cold, diaphoretic, they're crumping, they look awful, right? That's a big sick patient. So you translate that to EKG world, and things like, STEMI, asystole, VTAC, VFib, those would be big sick. Someone who's profoundly Brady, those would be big sick. And if they're not big sick, right, you can continue on with your interpretation. But if they are big sick, you don't do the rest of the things. It's like a hard stop. It's like, okay, their heart rate of 30, they barely have a pulse, they're pale, cool, and diaphoretic. I don't care what the axis is. Like they're going wherever they're going, to the ER, or calling the ambulance, right? Or whatever they need. So it's like a hard stop in your mind. Can I proceed on? Okay. Yes, exactly. I like that, Silas. And I won't say that because yes, but good. So I wanted to share one other case with you guys really quick before we wrap. And I wanted to tell you that literally no patient's face. This patient had shoulder pain when they work out. So it's exertional. This patient has lots of medical comorbidities, right? I like to call this the trifecta: diabetes, hypertension, hyperlipidemia. And then this is the EKG, and literally this EKG is something that should go to the cath lab today. It's not a STEMI, but it should go to the cath lab today. So this is this is number 2 finding on a list of like 10 things on that chart in that article. This is one of those findings. Okay, so this is just really quickly, I'm going to walk you through this. This is the kind of stuff that we go through with you as we take you further in your education, where you can start to see that when you draw your lines, as KJ loves to say, you can see that there starts to become a pattern of ST depression kind of popping out here, and it's widespread. And then you also have your ST elevation here, right, in AVR. And so this pattern means they have an LAD occlusion and they need to go to the cath lab. It's something that they actually list in the bottom part of the chart, that it's not a STEMI equivalent, but it needs to go to the cath lab, okay? So depression is also important, as is elevation. So actually the 30-day starts March 11th, so we have not started it yet. And we are going to do some bonus classes next week in between, some basic rhythm stuff, just as an opportunity to get your feet wet in the group. And then we do our official kickoff call on the 11th of March. So you have plenty of time if you want to still get in. And if you get in now, you'll get to go to some other bonus classes as well. So this is officially our thank you for the evening. But if you want to hear more about the 30-day, I'm going to spend about 5 minutes talking about it to show you a couple things that would be helpful if you're considering joining us in the program. Okay. And if you're not interested, you can totally sign off now, and hopefully you feel complete. We are going to put the recording in the guide section and also on our replay link. But if you're interested in hearing more, here's the skinny. Okay. So this is a group where we spend 30 days with you starting March 11th, where we get you up and running quickly with learning EKGs. And this is basically a chance in this 3-day EKG challenge to see how we teach, to be exposed to just two of us. There's actually way more instructors that you have access to in the group. And we're a group of wonderful, encouraging folks that want you to succeed. Okay, so this program is both recorded, so you have access to 2 to 3 years of recordings, but you also have live classes that are also recorded. So you can kind of do whatever suits your schedule. So Ruben's posting the link. Thank you, Ruben, for posting that. And here's the schedule that's coming up just for March, okay? And we keep going and keep going and keep going all year long. And when you join us, you get, so if you're the scholarship winner, you only get 1 month. But if you join us for the full 30-day challenge, you actually get 6 months. So you get the 30 days, you get the welcome kit, which I'm going to show you. You're going to actually get some other cool things too, which I'll show you. But in a nutshell, you are going to get access for 6 months to absorb, because once you go through the 30, you're going to be like, oh, I can do this. And then you're going to get to reinforce and reinforce and reinforce. We don't do the same classes all the time. We have a set of core classes, for example, the welcome terminology call. For example, Michelle does a 12 lead that's an hour and a half that's so good and so visual. So that's like 11th and the 12th. And then we have Sean, who is one of our medics, coming on doing arrhythmias and heart blocks. And he does dynamic and live strips like we did yesterday. And he's so great. He has a bunch of real strips he brings. We're also going to do some arrhythmias on the 6th as a bonus. So you're going to get super strong in arrhythmias. And then David, this is for our ongoing people who are in with us for a long time. He does these study halls every 2 weeks consistently throughout the year. And you can actually submit EKGs where he'll break them down for you. So it's super, super good resource. So imagine having access to people who can answer your questions and don't just leave you hanging, right? We don't just teach you, but we keep on nurturing you as we go. Now, one thing we're adding on this time, which we haven't done in a long time, is I'm going to do some office hours the first week. So you can come on with me. It's unscheduled. You don't need an appointment. You just come on and you can talk about, ask questions about whatever you need. Or you can say, hey, where's this? Or can you explain to me a little bit more about, ST elevation? Can we go over this EKG together? So basically that's a time where you guys can just hop on and we'll just take you one by one and go through any questions that you guys have. So you can even bring cases that you've had that you're like scratching your head on, and we can go through those too. Okay. And Callie says, no one has ever helped me so much. We love you, Callie. We love you. And then this is kind of the crowning jewel of the whole 30 days together is this workshop, because this is the one I'm telling you about. We're going to go through all of those non-specific STT wave changes, and you're going to get to learn in like 2.5 hours. You're going to be well seasoned. So you're going to basically do this, like build the foundations. And then here is where you use the thing we mailed to you, which I'm going to show you in a second. We have some bonus coaches. Erin's going to come in. She's she's a PA, EP. She's going to talk about devices. We're going to have Michelle doing more STEMI practice because it's super important to pick it up, right? I'm going to do hypertension cases for you. So no matter what part of the world you work in, right? Except for if you're in EMS, you're going to be treating hypertension with medication. So we want to talk about what are the medications you use? How do you pick them? And then we're going to have a special session called Day in the Life with Erin, an EP. And that's just March. We have obviously more stuff coming. So you have access to previous classes, right? Where in this workshop, we color code the EKG with you. We give you tools. We give you ways to learn this stuff so it's not so intimidating. But in the group, you also have access to all these other classes. This is like a fraction, okay? This is a fraction of things we have in there. So literally, if there's something you want to learn about, valves, CHF guidelines, farm, whatever, we've probably already got it. We can either make a new lecture for you or we can tag you in the old one. So it's a great resource to have. And so the things you're going to get, I'm going to show these to you in a second, but you're going to get 12 hours of category 1 CE for EMS, NP, PA. I think that's it. Yeah, and or RN as well. And you're going to get access to 2 Facebook groups, our 30-day EKG group with all these coaches, and also a more basic group, which is called the Launchpad. And the Launchpad is where all the 2 years of basic stuff. So if you're like, a newbie, and you're like, I just want to swim in the shallow end for a little longer, that's where all the very basic, like, what's a P wave? What's a Q wave. Can we talk a little bit more about that? What's the anatomy of the heart? Like we have tons of stuff in there. And Michelle and I can be your concierges on where to look for things. I'm going to send you this little workbook that we're going to go over on the 17th. We're going to do that together. It'll be recorded if you can't make it, but there's real EKGs in here. We use our crayons to color code contiguous leads, reciprocal changes. We're also going to send you this badge, this RCAT badge, so you can use it in clinic. We're going to show you how to use it and give you a handout in your box. But basically, you're going to be able to look for ST elevation, which is so great. And I send it all in this workshop kit. Gets mailed to your home. I'll be mailing them out tonight. But you're also going to get a binder, which I didn't show you. So I'll show you that at the end. And the price to get in, the investment is for students with no CE. You get in for 6 months, so that's for $149. Okay. You can choose that link when you go into our link. You choose student, it's $149. EMS, it's only $149 as well. And you still get the 12 hours of CME. RN is $249 and NP and PA is $299. And that's for 6 months with us. So the one other thing I wanted to share with you is that the first 10 people that sign up, I'm also going to give you some, you can see paint on my nails. I'm also going to give you some note cards with question and answer with some findings of EKG so you can review. So the first 10 people are going to get note cards in addition to all the rest of the stuff. Now I showed you the box, right? All the stuff in the box, but you're also going to get a binder. So in the group, there's a lot of things that you're going to want to print out. So you have a binder that we're going to mail to you with your kit, and you can label and put anything in here you want. And that's just really exciting. And so I want to show you really quick if I can share my screen. I'm going to see if I can find something to share with you guys. So yeah, this is the actual learning portal that you're going to get access to. And so these are your CE classes right here. So when you sign up, you get instant access to this. And this has all the stuff for the CE. You're going to have access to this even if one day you're no longer decide to continue on with us. We do give you an option, by the way, at the end. And some people have been in with us for like 2 or 3 years because we keep changing up the material and they want to stick around, right? So this is all here. Again, this is really cool, but perhaps the cooler part is that let's just say, you really want to get a minute to look around and take things step by step. So we put this into 30 days. You could watch something each day. And there's a video in here where we just talk about the waves. It's probably like, I think 6 or 7 minutes. Oh, it's 18. Okay. And then we do rhythm review that's in here, but you'll have access to this even later. So this is really cool. And you also get access to Facebook group. So that's the skinny on what we have to offer for you guys. And then let me show you what's in the box as well. And just so you have a firm understanding, here it is. EKG workshop kit. You're going to get the crayons so that we can color code together the 12 lead, the contiguous leads. You're going to actually get, I forgot to tell you, you also get one of these as well. You get the big version. It's called the RCAT window, but you also get the badge. Okay, this, no matter what level you join us at, you get all of these things. The workbook, which is here. And I forgot to tell you, I also give you a cheat sheet, which outlines all of my patented ways to remember things. And it's all on one sheet. So that's what we have for you. And we are so excited to welcome you inside. If you join and you're the first 10, you get those extra note cards as well. But everybody who joins will get the box and the binder, of course. And we are going to be giving you a little bit of time because a lot of people like to kind of digest the 3-day and they like to okay, I'm going to just go back and rewatch. And then that's why we give you time until March 11th. So then you're ready to hit the ground running. But if you get in the group and you're like, oh my gosh, like tomorrow, Michelle, you're doing a basic class tomorrow, right? In the 30-day?
I did the
I'm pretty
basic
sure.
Yeah, I did the basic last week, and this week, tomorrow we're going to just refresh and do about 5
Okay.
semis.
Awesome. So, oh, Jules, I think you said you just joined. We're so excited. I'll be mailing out your kit, so keep your eye out for it. And yeah, that's the skinny. So we just want to say thank you for being with us. Thank you for participating. I know we've had a lot of new faces. It's been really fun to meet you guys. And if you have any questions, let us know, Michelle or I. Matt says, trust me, buy a bigger binder. Yeah, Matt is right. But let us know if you have any questions. We're going to put this on the replay page in just a few. And Michelle, thank you for doing your game. When you get in the group, you're going to see so many classes by Michelle, and they are all good. So we'll be a good resource for you. And we're super excited to welcome you with open arms. So anyway, the link is in the chat. If you want to grab your spot, try to be one of the first 10 so you can also get the note cards. And we will see you in the 30 day. Okay, bye guys.